Mr. M is dual eligible, having both Medicare and Medicaid. He lives in public housing with his wife and 2 grown children. His medical history includes diabetes, hypertension, atherosclerosis, and end-stage renal disease. He is currently on kidney dialysis. Mr. M was recently hospitalized for ongoing complications from his diabetes and end-stage renal disease. He is overwhelmed by the complexity of all of his chronic conditions. He is scared, and he does not feel confident enough to take charge of his own care. He does not know where to find support or assistance, and most often does not regularly take his medications or follow his recommended diet. During his latest hospitalization, all of the toes on his left foot were amputated. He was then transferred to a skilled nursing facility for physical therapy. During his stay at the skilled nursing facility, he developed a post-surgical site infection and was placed on oral antibiotics. His appetite was poor, and soon he developed a stage 3 pressure ulcer on his heel. His symptoms worsened after 5 days. He was transferred back to the hospital. Mr. M was very ill. He was not responding to antibiotics. His surgical site infection was worsening, and his pressure ulcer was now a stage 4. Mr. M did make some improvement, and on day 10, the physician told the family that Mr. M would be transferred back to the skilled nursing facility. His second stay at the skilled nursing facility was uneventful. Mr. M's foot surgical site healed. However, his stage 4 ulcer required daily dressing changes and assessment. After 3 weeks in the skilled nursing facility, he was transferred home with home health services to treat Mr. M's heel ulcer. When the home health nurse arrived at Mr. M's home, she noted several medication discrepancies. There were several medications in the home that Mr. M was taking that were not on the paper medication record that came from the skilled nursing facility. She phoned the primary care physician, who doesn't have an electronic medical record, but he did not have any knowledge that the patient was in the hospital or the skilled nursing facility. After 2 hours of making calls, the nurse was able to confirm the medication record with the physician's orders so that Mr. M was on the correct regimen. After 60 days with home health, a notice of non-coverage was issued to Mr. M by the home health agency with the intent to discharge the patient from home health services. The plan was for the family to assume the dressing changes as had been taught by the agency. The family called the Quality Improvement Organization to appeal as they expressed concern that they could not cope with all of Mr. M's needs and would not be able to do the wound care that was still required. After the QIO review by a physician reviewer of the patient's records, the physician's decision was made that home health services continued to be medically necessary, and home health was able to be continued for another 60 days.